nightmare scenarios. A house overrun with spiders, my mind would break. No way I could deal with that. The webs creep me out too. Touching a web, dealing with webs on me is just as bad as the spider itself. If I actually make physical contact with a spider, or should I say one makes it with me, I'm ruined. My reaction to spiders, panic. Incredible adrenaline rush, and panic. And I prefer to never have to look at one ever again.
Alfred Kinsey has a serious problem with spiders. He's terrified of them. Alfred is a big guy, 6'5" and more than 200 pounds. But even a tiny spider can throw him headlong into panic.
If spiders wound up in my home, my attitude was that if they were in my home, if they were in my space, then they had a will to die. One night, I felt like something was crawling on me, and I pulled the sheets back, and there was something crawling on me. It was a spider, and I completely came out of my skin. I remember jumping up, screaming, cursing, and taking a gun and pointing it at the spider on the bed. I was going to shoot a spider, right? I was going to shoot it. And my wife, as calmly as she could, explained to me that it was a pretty psycho thing to do. And she relieved me of the gun at that point.
Alfred's extreme reaction marks him as a true arachnophobic, and he's in good company. The fear of spiders is one of the most common of all phobias. Historians have tracked arachnophobia at least as far back as the Middle Ages, when spiders were believed to carry the Black Death. Today, we know that's not true. Nearly all of the 35,000 species of spiders are harmless. Even the poisonous ones cause only a couple of deaths in the US each year. But for most of us, spiders are just plain creepy. Movie director Wes Craven is a master of Hollywood horror. He understands our fear of spiders.
There's something about the configuration of a spider's body that looks like a hand, but it doesn't have a mind attached to it that you can relate to. You know, you can't look into its eyes. You can't quite guess its personality. And it has venom, which I think almost all animals that have venom are high on the list of human phobias.
Just seeing them can trigger stark terror. Yeah, it's the incredible adrenaline and, you know, shaking. The whole 9 yards.
Alfred's friend Greg Evans has seen his phobia in action.
I've known Alfred for about 7 years, and it's funny. He's a big guy. He's confident. He's strong, but I've never seen anyone melt as quickly as anyone when Alfred encounters a spider, sees a spider, knows it's there.
Friends and family don't always understand how powerful a phobia can be.
I know I did some things to scare him on purpose with spiders, but eventually I realized that it was for real, and he really had a fear of these spiders, which I still can't understand, but I understand it, and I don't mess with him really much anymore.
Alfred's father may have some clues to how his phobia began.
I had him on my shoulders and carried him, and man, we ran into one of those big, huge spider webs that just engulfed his face.
It terrified me, and because it just was there.
And I thought he was going to have a heart attack as young as he was.
Many people with arachnophobia never seek help. They're held back by their embarrassment or by their fear of having to face a living spider. Alfred has decided it's time to do something about his phobia.
I don't want it to progress to a point where I can't function. You know, I don't want it to be 300% worse than it is now. If that's at all possible, I'm not sure.
While arachnophobia is not uncommon in the general population, it's pretty rare among men. Dr. Michael Telch is a clinical psychologist in Austin, Texas, and an expert on phobias.
The research is clear that women are more likely to develop a clinical phobia than men. About 12 to 13% for women and about 3% for men. We're talking about differences in who shows a clinical phobia, not who has the courage to go in for treatment.
Over the last years, it's gotten embarrassing. I'm a big fella, so I'm sure it looks kind of funny to see me react in such a manner to such, a smaller thing.
Alfred is obviously a person with a very significant, severe phobia of spiders.
I know it's a problem, and yeah, I want to make it go away. I don't like what I have to do to make it go away.
We usually try to get patients to a point where they can actually have a spider either crawl on their hands or crawl up their arms or hold a spider in the palm of their hand.
That scares me a lot.
We're talking about courage. Alfred's going to have to say, look, I'm going to persist in the face of my fear.
He's not trying to give me emotional scars. He's trying to help me.
Alfred's desire to overcome his phobia has brought him to Dr. Telch's clinic, the laboratory for the study of anxiety disorders at the University of Texas. A series of preliminary tests to see how quickly Alfred's fear responses kick in. They start with something easy. Alfred just has to deal with a page of spider-related words. Next comes a picture of a tarantula, then a rubber spider.
Okay, start now.
It's only a toy, but for Alfred, this is too close to the real thing. His flushed face reveals his fear.
Stop, move it. Okay. How many seconds?
This is as far as Alfred can go for today.
One might think, well, just because he's so severe that he's really going to profit little from the treatment, but that hasn't been our experience, and our data suggests that even though he's starting at a very severe place, that I think still very optimistic that we're going to get him to be touching real spiders.
The next session marks the real start of therapy.
It's right there. Just let's scoot up so you're not there. I know it's there. You go.
Oh my God. Oh my God.
Perfect. And you didn't even move your hands. Now that's awesome.
I'm not sure I can.
This cage contains a live spider. She's a tarantula named Tammy Faye. Alfred will estimate his fear level using a scale of 1 to 100.
Blowing usually works.
Oh my God.
Okay,
oh my
right.
God. Oh my God. Oh my
All right,
God.
the
Oh my
blowing
God.
works.
That's just.
It's disgusting
That is
for you, right?
This
But-
is
but
she's
that's
coming
okay.
toward me.
You're doing great.
You're doing great.
Didn't even move.
I'm not sure that I can.
Well, then try it to show yourself that you can move.
Okay, I can. That's
You
good.
can move. How about putting your hand right on the aquarium? Come on, let the fear come. It's just going to be a spike. Terrific.
Step by step, Dr. Telch ups the ante. The goal is to trigger Alfred's fear while showing him that he's not in any real danger.
It's a little cold for her.
Can you?
Oh, Jesus.
You can touch on top if you wanted.
No.
Let's try. Let's just try.
You said if I wanted.
Well, you know what I mean.
Okay. Yeah, oh
Let's
my
give it a
God.
try.
This is not.
Oh, so the top is hard. I thought right by the spider would be the hardest for you.
There's air holes on the top.
Ah, I am so glad you told me about that. So now we might even be able to activate your fear even more. You scoot up a little bit forward. There you go. Right there, like that.
Oh, jeez. Oh my God.
All right, hold on to it. There we go.
Your rating would be?
90.
So those air holes really get to you, eh?
Yeah. Well, there's potential for touching the spider through these.
Where do you think the spider is right now? I think it's right by your hand?
I'm praying that it's on the bottom of the cage.
Okay, wish it to be on the top, right by your hands. Come
All
on. Say, come on, Tammy Faye, right by my hands. See if you... Come on, say it out loud just so we know that you're really thinking that. Come on, get my fingers.
Oh man.
Come
that's
on,
rough.
come on, get my fingers. Can you say
All
that
right,
out loud?
Tammy Faye.
Shake my fingers.
Shake my fingers.
Shake my fingers. I'd like to meet you, Tammy Faye.
Oh my God.
Well, we can't do anything more challenging than this with the cage, that's for sure. I think it's a wrap for today.
I just really didn't want to do it. I really didn't want to do it. But I knew I had to. Otherwise, you know, I'm just going to be a basket case forever.
This session was exhausting, but Alfred will face more spiders and more fear soon. His therapy is only beginning. Even though arachnophobia is fairly rare, spiders do make most of us uncomfortable. But some people, like Tom Prentice, just can't get enough of them. Tom is an entomologist at the University of California, Riverside. As far back as he can remember, he's had a passion for the eight-legged creatures.
I keep spiders in my closet here. Most of the ones I keep in here are the ones I want to keep a fairly close eye on. This specimen right here is from Deep Canyon, which is a desert area down near Palm Springs, Indio area. This one is from a desert area in Arizona. Both of these are mature females. This one has not molted since the day I collected it. I don't know why people are afraid of spiders. I don't know if it starts out that way or there's an incident involved or actually if some people are just born with certain fears. I don't have any idea. Spiders are absolutely beautiful. You take one of those and put it under a microscope and the adornment, the spination, everything, it's just absolutely incredible.
For Tom, it's hard to imagine being afraid of a spider. He's the kind of guy who will spend the night in the desert looking for black widows.
I'm much more of a threat to them than they are to me. That's why I have to be really gentle with this stick. Basically, the first thing that they would do is if they sense that I'm a large predator, would be scurry right back down in the hole. They just don't have a tendency to bite. You'd almost have to grab or pinch a leg for them to bite you. The black widow has definitely killed people before, but as I say, mostly they're small children and older people with respiratory problems. A normal, healthy human being has really little to worry about. How black she is. She's a mature female. All spiders are actually fairly docile to human beings. The black widow's no different.
In Tom's world, spiders inspire not fear or anxiety, but admiration. It's been less than 2 weeks since Alfred began his therapy, and he's already getting used to being around spiders.
Why don't you put these on?
But he still hasn't held one. Today could be the day. He'll start out with something to make it a little easier, a pair of thick rubber gloves.
This is true.
Your nose is very light and very delicate.
Yeah, I can still feel them.
So you're able to feel them even through the gloves?
Oh, yeah.
What's your fear level right now?
50.
How about eyes closed?
Oh, God.
Yeah, I knew that might do it, huh? Eyes closed and head down, just there you go. The act of doing this is basically sending the message, boy, I'm trusting this spider. I'm trusting this spider. This spider's not going to do anything. Okay, give us a fear level.
20.
Okay. Switch hands again. There you go. You're definitely getting the hang of this. Everything the same, but bring them closer to you. Perfect. Just what you anticipate even before I said it.
Well, I couldn't stretch much further.
Okay. Fear level now?
20.
Now the moment of truth. The gloves come off.
Okay.
There will be
Now.
nothing between Alfred and the spider.
Okay. Fear right now?
90.
So you're really, really up there, huh? Fear-wise.
Yep.
Okay. Terrific. It's amazing.
Can't believe you guys.
I really like the way you're bringing him towards you. That's really sending a powerful message that this is not a threatening thing to do.
What's your fear level right now?
30.
The lower fear level is a sure sign the therapy is working.
Yeah, it's kind of bizarre.
What's your fear level now? Gone?
Yeah.
I think you got it, buddy. I do. I really do think you have it.
To see how far Alfred has come, they head to a shop that houses more spiders than he's ever dreamed of encountering. Dr. Telch checks out the place first.
The purpose of this is to just see the extent to which the treatment that we've done with Alfred is really carrying over.
This is the world's largest species, tarantula from Utah. And as you can see, so I'll let you hold him. And I think I'm going to let you handle this girl in the other hand.
Just 2 weeks ago, no one who knows Alfred well would have imagined a scene like this.
That's it.
Alfred's brother Ed can hardly believe his eyes.
I didn't think you'd do it at all. There's no way. You've got to be creeping out.
No, I'm cool. I'm cool.
That's amazing. That's incredible.
And
Congratulations, man. That's really, really amazing, man. Keep it up.
Yeah.
Fantastic.
Thank you.
This was a very successful demonstration. I think it illustrates really two important points, two necessary ingredients for recovery from specific phobia. One is you need someone who at least has the courage to undergo treatment, and you can't help but see the power in these methods.
I didn't think it was possible that I'd be able to do this. I really didn't. I'm pretty excited about this. I never would have thought it was possible to get to where I am right now. I'm not afraid of spiders anymore.